Disability competency versus disability clinical competency. They sound similar, yet they're different. Disability competency relates to understanding the world of people with intellectual and developmental disabilities, the environments, the situations. And it's very important for all clinicians and for supporters to understand that. Things like how do people communicate differently and what's the best way to communicate with a person with intellectual and developmental disabilities? How do we provide appropriate materials and educational materials, say, for healthcare issues? How do we make sure that our environments, our waiting rooms, our offices, our hospitals are accessible for people with different levels of abilities? But the National Council on Disability in their health equity framework earlier this year specifically mentioned the need for clinicians to receive disability clinical training to become disability clinically competent. What that means is that clinicians should be trained on diagnostic skills and developing skill sets and learning how to provide good health care to people with intellectual and developmental disabilities. It might mean understanding how different behaviors can point to specific underlying conditions, which means that there's different presentations for very common illnesses sometimes in people with IDD. Medications may affect people differently in people with IDD. There are conditions that are more common. So how do we know what to look for? What are the risk factors that are specifically related to people with intellectual and developmental disabilities as to why aspiration pneumonia might be more prevalent or gastroesophageal reflux might go undiagnosed. So developing disability clinical competency is very important. If you are looking for a way to do that, click on replacingrisk.com and click on the Clinician Education button. There you will see a course specifically geared to teach clinical competency to healthcare providers, both students and practicing clinicians alike. It's called the Curriculum in IDD Healthcare. Take a look.